So you are thinking, oh man, I was just going to get a Johnson & Johnson COVID vaccine, and all of a sudden it is pulled, it is paused. Or you said that, hey, I got a shot, I just got a Johnson & Johnson vaccine, and it's going to cause clots. Well, stay tuned. And also, you probably be thinking, yeah, we told you that the shots are not safe, these people have rushed this and all that. Well, watch all the way to the end. The Johnson & Johnson vaccine, or the Janssen vaccine, has been paused, and this is because of the incidence of blood clots in the brain for the most part. The type of clot is called cerebral venous sinus thrombosis, or CVST, and this basically is just a clot in the brain, just to be short. And this has occurred in 6 people out of 6.8 million who have received the vaccine in the United States. In other words, approximately out of approximately 7 million, 6 people have gotten the clot. One of them has passed away. Another one is in critical condition. The other thing is these clots have occurred in people ages 18 to 48. And all these people were also women. They also found that apart from the clots, these people also have low platelets or thrombocytopenia. Their platelet levels had decreased. The implications is very much important in treatment. Right, now let's go to what are the implications for the ordinary patient, for any patient, not the doctors or practitioners. If you have received the shot and the vaccine from the Johnson & Johnson batch, and it is within the last few weeks, let's say under a month, if you have received the vaccine and it's not been a month yet, just be careful of these signs. If you see these signs, you should go to your doctor or your provider as soon as possible. Again, these are very rare. 1 in a million. It is 6 in 7 million, so approximately 1 in a million are the ones that are going to see this. So no cause for alarm, but if you have received the vaccine within the last couple of weeks, it's not been a month. If it's been a month, your risks have decreased because all the people who got the shot, who got the clots with the Johnson & Johnson vaccine, had it within the first couple of weeks. So if you haven't had a month past, just be aware that if you have symptoms such as severe headaches, if you have severe headache, or you have abdominal pain, or you have leg pain, or you have shortness of breath, you can breathe as well, then those are signs of clot basically. You should see your provider immediately and let them know you had a vaccine from the Johnson & Johnson batch. And again, this is potentially going to be happening in 1 in a million people. So, but it's good to be just be aware of it in case you have those symptoms. Otherwise, there's no cause for alarm. If you had the Johnson & Johnson vaccine and it's more than a month, you are clear. I mean, there's no reason to be alarmed. Even after 2 weeks, potentially you are fine. I mean, everybody is fine basically, but just as a precaution, have that in mind. If you have severe headache, if you have leg pain, if you have chest pain or shortness of breath, then make sure abdominal pain, you should contact your provider immediately, just so that if it is a clot related to the vaccine, you can be quickly treated. So what are the implications for us as regular people who are thinking of getting the vaccine? We would still say get the vaccine. There is no cause for alarm. Now, one virologist said something very well. I think her name is Angie Rasmussen from Georgetown University. She's saying that she took oral birth controls for 20 years. And if you didn't know, oral birth controls have a risk of blood clots associated with it. And the risk for blood clots are even higher. As a matter of fact, 1 in 100 people who take birth controls can get a clot. Granted, the clots are different types of clots, but 1 in 100 people versus 1 in a million with Johnson & Johnson vaccine. So it is extremely rare with the vaccine. Moreover, if you get a coronavirus disease without any vaccine, you can have a clot. In fact, your chance of getting a clot are higher with a COVID disease than the chances of getting the clot with the vaccine. So it is extremely rare. And this lady, Angie, said that she would take the chance to get the Johnson & Johnson shot if after 20 years of being on a birth control, she didn't get the blood clot, which is associated with 1 in every 100 people. Then you can do the math how rare it is for somebody with a COVID shot from Johnson & Johnson to get the clot. And again, granted, the clot types are different, but 1 in a million versus 1 in 100. And also, just another thing here, if you fly a lot, or if you ever be on a plane for more than 4 hours, you have a higher incidence of getting a blood clot, the type called DVT. But people still fly every day, fly for more than 4 hours. I mean, people who know try to walk around, just to make sure the blood is flowing while in the plane. But how many of you have flown and sat for more than 4 hours, knowing the risk, and yet you still flew? And that is more risky than just getting the Johnson & Johnson vaccine. So that is the implications that we have to think about. That being said, given all those pieces of information, that being said, if I were you, or if I am the person who is going to get the Johnson & Johnson vaccine, as we wait for the CDC and FDA to do their review, the thorough review, and make recommendations as to who should continue to get the vaccine from Johnson & Johnson and who shouldn't. I'm pretty sure we are still going to bring the vaccine back on board, but they are going to make recommendations as to who should get it and who shouldn't. Before those recommendations come, this is my own personal recommendations. If you have risk factors for blood clots, if before even getting the shot, getting the Johnson & Johnson shot, you're already at risk of having blood clots, then obviously holding off for getting Johnson & Johnson vaccine would be a better choice. And the risk include people who are being treated for cancer or people with cancer. Your risk of blood clots is already higher. So if you're getting the vaccine, then you probably should get Pfizer or Moderna. Also, if people who are in menopause, who are taking hormonal treatments for menopause, because you are also using hormones, most likely you'll be using estrogen, and your age is also up there, I would also recommend that you take a different vaccine. A person with limited mobility, you don't move around a lot, you are stuck in a wheelchair all the time, or you are obese, you are seriously obese, already you are so big that you are at risk of getting a black clot, then you should also probably get a different vaccine. And then if you are pregnant or have given birth and it's not been 3 months yet, you are also at risk for black clots already. So for that reason, you should also get a different vaccine. I'm pretty sure the FDA is going to bring a detailed info. They may say that what I have even said is not even risky enough for you to get it. But before they come out, this is my own personal recommendations that if you're already at risk of black clots, then you are the person that may be hesitant in getting that vaccine when it comes out. Apart from that, there's no reason to be alarmed about getting the Johnson & Johnson black clot. And I think Angie said it quite very well. If you have a risk of 1 in 100 getting black clots in taking birth control, and yet birth controls have been taken all the time, then getting a risk of 1 in a million to prevent you from getting black clot itself from coronavirus, which can kill you, and also getting on a ventilator and dying, I think it is worth taking that risk of, getting Johnson & Johnson vaccine to prevent you from getting COVID. The FDA, as I think I alluded to, the CDC is advising practitioners or providers to basically watch out for treating clots. If you have patients that come in with clots as part of your clinical diagnostic information gathering, be aware of whether or not the patient had received vaccine recently, which will inform you as to what to do. And providers are encouraged to refer clots that are associated with vaccinations to experienced clinicians who deal with clots in order to have better outcomes. Or generally, heparin is used generally, but because this clot also occurs at the same time as platelet counts have gone down, providers have been advised to stay away from using heparin for treatment, because that could be a disaster. If you use heparin, you are going to eventually lead to bleeding in the brain. So in order for them to really know what to use and the best practices with treatment, they are reviewing the data and also to make recommendations across the board for providers to see what to do when they come across the clots that result from the Janssen vaccine. All right, so we'll wrap it up here. Don't forget to like, don't forget to subscribe to this channel and comment below. If you're a healthcare provider and you have more information to add, just put it in the comment section and we will all read it.